I wish I was in a position to share my screen, but I will try to verbally share the assignments for committees for board members. Oh, so some of you were able to submit your preferences and others were assigned. If you have any questions about your assignment, please feel free to email myself, including April, and then we can talk about that offline. So without further ado, we have the 3 committees. And so I'll start with governance and nominating, which will have April Meckens-Jolly as chair. And Dr. Colleen McNichols is also on that committee. And then Elizabeth Wright, you will be on that committee as well. And then for academic and public health collaborations, we have Dr. Imbaugh as the chair. I am a member of that committee. Robert Gator, and please forgive me if I'm mispronouncing your name, is on that committee, and Morgan Shields is also on that committee. And then for community engagement, I am the chair for that committee. Dr. Tepe is on that committee, Tepe is on that committee, and Barbara, you were on that committee, and Brittany Jones is on that committee. And so I do want you to make note of the chairs. At some point, your chairs will reach out to you to try to schedule committee meetings. Those sessions will happen outside of board meetings where you will work collaboratively to push the mission forward or think strategically about your role in terms of maintaining and supporting the DOH. If you have any questions, again, please feel free to email me. And that's all, folks.
Thank you so much, Kristen. I will just pause for a moment and ask if any of our board members have questions or feedback about these committee assignments. Well, I'm sure as the committees start to form and get into some more meaty work, there might be some more questions that come up. So I'm looking forward to seeing what comes out of these committees and what value all of you add to this team. So, okay, well, thank you so much, Kristen. I know that you may have to jump off of this call as you have to head into a meeting. But I think this is a good time for us, Dr. Monty, to move into the agenda section regarding the budget. Would you like to kick that off?
Absolutely. Shantae, I just forwarded you the slides. If you're able to run them for me, I'm having a little trouble on my side. And I'll get started. I want to introduce, if he's on the call, Emmanuel Kani is our Fiscal Bureau Chief. And he has been Fiscal Bureau Chief for how many years now, Emmanuel? You're muted, Emmanuel.
The 5th year, going to the 5th year.
5th year, yeah.
Yes.
We'll be sending out a memo this year. Can we do them in presentation mode? Okay, it's coming. We'll be sending you a memo of some of the accomplishments, but most recently, under Emmanuel's leadership, the department has, for the first time in I don't know how long, not had any findings in a citywide KPMG annual audit. This has taken a lot of work. The Bureau now is over double the size it was when I joined, close to triple. We have a full-time auditor under Emmanuel's leadership. Our 1.5-year contract with Armamino, which is an accounting firm, assisted with the development of SOPs. And so I just want to commend Emmanuel for his leadership and get into the FY25 budget. So this is the presentation that we gave to the Board of Aldermen in May. I will go through that, but I will also let you know what we, preliminarily, the budget hasn't been finalized. We should get the final budget in the next couple of weeks. But as I go through it, I'll let you know what we did get. So next slide, please. So this slide walks us through the overall numbers for the Department of Health. The actual budget in 2023 was $30.1 million. The budgeted amount for 2024 was $33.2 million. And the proposed amount for the 2025 is $35.7 million. Next slide, please. When you look at general versus grant funds, Department of Health for fiscal year 23, we'll start with that first on the left. So the department's general funding was only slightly over the department's grant funding. So general funding being nearly $16.7 million and grant funds being $16.5 million. So when I joined, just over 52% grant funded. For the upcoming budget, the general funds will be nearly $19.7 million and grant funds will be $16 million. Next slide, please. So let's talk about the priorities for this upcoming for FY25 budget year. The new animal care and control shelter building is top of line. The current space is inadequate for employees, veterinary care, reception area, space for adoption procedures. It's inadequate for outdoor space for enrichment and storage oversight of the healthcare provider as well will be coming later. But as far as the animal care and control building, that's where our main priority is. We've just outgrown it by all of the parameters that you see there. We also, and this is due to a couple of things. I think when I came in 2021, we only had 2 animal care and control officers for the city of St. Louis. We have 10 now under supervisors. So our capacity to be able to attend to what's happening in the city has increased, is still inadequate, but has increased. And so the shelter needs to grow with that. Every year we get numbers from our subcontractor CareSTL, and the numbers of animals that we are bringing in have just increased. So we are in desperate need of that new animal care and control shelter building. Many thanks to those of you who did try to assist with letters of advocacy and also trying to be innovative around other partners that can assist. We still have a need. We still have not finalized a building. The mayor's office continues to work to advocate for MSI, the MSI building, which would require a lot of renovations for us to use, and this will take time. Next is an Office of Strategy, Quality Management, and Health Equity. So these are areas that should be foundational to any Department of Health. They haven't existed ever in the department. When I joined the department, we had one person who was taking on the work of quality as well as reaccreditation for the region, which is just unacceptable. And so we're doing a couple of things. We want to reorganize staff to strategize towards building and reviving a Department of Health to fully and equitably meet the needs of our residents. This is especially important coming out of COVID, right? COVID was just a reactive time, all hands on deck, but we really want to have a department that thrives, and programs need an environment of quality in order to support the programs, in order to innovate. So one of the things we do have is an RFP that just closed around 2 areas of quality management, evaluation, KPI development, so that we have those foundationally. Those just didn't exist when I came. But we would like to grow the department itself. The preliminary budget we've received does not make me believe that has been supported. We asked for positions to support this new bureau, and those in the preliminary budget were not funded. So we will continue to advocate for this in future years. And then internal investment. We wanted dedicated personnel for DEI and health equity, and education and engagement as well. We need to have an environment where there is training that is public health specific, which hasn't occurred. And then health equity is the foundation of all we do. So we had advocated for an officer. Again, the preliminary budget does not show that those were supported. We did see support from the city for $1 million towards animal care and control and potentially the new shelter. So we hope that that will help with efforts. Next slide, please. So there's the main change that you're going to see in the budget that reflected the increase that you saw from last year's to this year in the general funds that increased is the position that we were asked to take in oversight and evaluation of the city jail. So in FY24, we began oversight of medical care at the City Justice Center with a transfer of $2 million to support those efforts. Funds were reallocated from the Division of Corrections, and those funds are to support full-time employees and operational funds for medical oversight. This includes a contract that we just started about 2 to 3 months ago with the National Accrediting Body for Medical Care in Jails, NCCHC. And they have already had a site visit a month ago. They give us quarterly reports that we're using for oversight. We took over in December of last year. Many of you may remember a lot of press around this, deaths in the jail over the past year. And since we have taken over oversight, there has not been a death, but that is not a metric to be proud of or to hang our hat on. Through the NCCHC's 2 reports that they've given us to date, we have committees in place for our 3 priority areas around healthcare delivery and mental health and substance abuse services in the jail. And so we're slowly seeing those metrics improve and provide a monthly report to the mayor's office. In FY25, we're also looking to create an inmate medical program section with clinically licensed staff to oversee the contracted healthcare provider who may also be able to perform clinical services when needed. So this is my plan to hopefully move into the area of us fully staffing CJC internally as opposed to subcontracting out services. But so far, we're pleased with the progress that we've seen here. Next slide, please. So if you want to take just a closer look at how this breaks down within the department, as you know, we have 8 bureaus, but this pie chart just gives you a little bit of an overview. So we have a healthcare trust that was built into the charter that's 100 years old, and that accounts for 25% of our current budget. This did not exist. So if you're looking at other places where it appears the budget has increased, that this is trust. Those funds were being used to support the Regional Health Commission annually with $5 million for a decade towards bringing Medicaid to the city. That contract ended in my first year. We provided them an extension because COVID had really made their situation challenging. And so we had this healthcare trust in our budget for the first year last year, back into our budget. The director's budget accounts for 16%, our communicable diseases section 13%, environmental health services, which is where animal care and control, food and beverage, and community sanitation, as well as emergency preparedness housed, is 12%. Animal care control itself is 11%. The inmate medical is now 10%. And family school health is 7%, and we now have a commissioner's budget that accounts for 5% of the budget. Next slide, please. So in looking at the director's budget, we moved 11 positions from that budget into its own discrete area for this new inmate medical. We also have strategic planning and quality improvement have been allocated to the newly established health commissioner's budget, so I moved those out of my budget. The commissioner's been doing a phenomenal job of overseeing that side of our work. For personnel, 9 positions were moved to the commissioner's office as well. 1 new position, an accounting coordinator, was approved for my budget. We requested just over 30 new positions for the Department of Health and received in the preliminary budget at least, I believe, 11. And then 2 utility workers were not approved. Those were in our budget last year and they were removed this year. So we'll be looking to make other plans as those 2 utility workers are to drive the vans that we have, and we definitely need somebody to drive them. This budget increased by $5,000 compared to last year, the other areas, rental and non-capital leases, reduced by $9,000, and non-capital equipment increased by $10,000. Contractual services reduced by $134,000 in this budget. Next slide, please. So that healthcare trust is where we operationally deal with most of the Behavioral Health Bureau. They'll be working on a communications campaign, hopefully trying to strengthen our website presence. We'd like a citizen-focused phone so that there are communications for mental and behavioral health 24 hours a day, 7 days a week. That does not exist as yet. They want to increase their presence in their criminal justice work as well and provide operational support to focus on strategy and quality. Next slide, please. So the CD budget, their hopes here are to provide technical assistance to community institutions. We want to expand condom distribution and HIV STI testing programs to surrounding counties and within the city, and to broaden TB awareness and education through screening clinics. 2 new positions were approved in FY25, 1 admin, an assistant 2, and 1 LPN. And no other noticeable changes were made in other categories in the preliminary budget that we've received thus far. Next slide, please. For animal care and control, we're looking to modernize and expand the vehicle fleet. It is very old and therefore very unsafe. This is already a very high-risk job. So they're in their cars all day patrolling, responding to needs of animals. So being in cars that are aged is not safe, and we're hoping to modernize the entire fleet with the city support. The shelter building you've heard about, we'd like to consolidate after-hours contacts into a single hotline to make communications for the city better and equip new officers with standardized equipment for safety and productivity. The budget basically has remained the same. From a personnel perspective, 13 people total, and no other noticeable changes between FY24 and 25. Next slide, please. For the rest of environmental health services, we want to establish a system to support online and in-person digital payments for food and beverage permits. When I came, everything was still paper. Money was actually being collected in hand, which was just shocking to me. And so I'm really proud of the team trying to move us into a fully online system. We want to modernize record keeping, fill the vacant environmental health officer positions, and identify professional development opportunities for staff coming out of COVID. The challenges we're going to see is the removal of these 2 utility workers, because we do need people to move these vans that we were very graciously funded through ARPA. So we'll be working on a plan to maybe do it part-time through per performance dollars, and then re-ask for those positions back in next year's budget. And we saw a decrease in computer supplies and internal services. So the teams, this bureau will have to make adjustments in that regard. Next slide, please. For family, school, and children's health, maternal child health will be the biggest priority that you see in the upcoming year. We have always been in the bottom states in the country around maternal child health indices. Those metrics worsened at the end of 2024. And so we are looking to provide pregnancy exams for early protection. And we will be announcing and bringing to this board a new doula pilot program to provide doula services to women and people who bear children in the city. The other priorities are to provide case management services for blood-lead poisoning in our children, accomplish 5 home inspections a month, provide vaccinations for school-age children, support women with breast cancer case management follow-up, and administer men's health presentations, and provide resources in the region as well. We asked for quite a few positions to support these needs. Those were not given to us in next year's budget, except for 1 community health worker that we're seeing in the preliminary budget. And no other noticeable changes. So I will stop there. Next slide, please. And take any questions for Emmanuel and I about the budget in general, or anything you heard today. And I see there's already been some activity in the chat. So Pauline asked, do you have discretion about redistribution funds once the budget is approved? We do, but it is at the discretion of the budget division and the Board of ENA. So we can make those requests. Some of those requests are at their discretion, I beg your pardon. And some we can do some internal trades. This is not something that is encouraged, as you can imagine, but we do have to do what we have to do when the budget is not what we had hoped. And then Rob, do you want to unmute and ask your question?
Sure. So I was just wondering about the Office of Strategy, Quality Management, and Health Equity, whether or not that's the office that does the sort of periodic community health assessment of the city. Whether that's where you imagine it will be done, or is that just, this is more of a rookie question.
No, that's not a rookie question. That's exactly right. Like, to actually imagine coming in and there's one person who does all the health assessments, anything quality, for a department for an entire city, for a major city, is just, it's unacceptable. So we've been asking for this office for the last 2 years in our budget requests, and we'll continue to ask for it, obviously. This year it wasn't supported, but that is what we imagined, is that the CHA, preparing and implementation for the CHIP. So people think it's just about, applying for reaccreditation. As soon as you apply, you go into the implementation part, right? You need an office to manage that. Like I said, all of the assessments, and internal program evaluation, and just a system of quality. When I joined, I always tell this story. I asked the managers just to give me kind of a report, their protocols, and I kept getting nothing. And finally, one of the managers said, we know what you're asking for, it just doesn't exist. We have to choose between doing the work and documenting, right? That's unacceptable for an entire Department of Health for a city. And so even those monthly reports you get are things that I introduced. They are completely bean counting and very rudimentary, but it's to at least start a system within which our bureaus got accustomed to, choosing for themselves what metrics are appropriate to follow for their programs, reporting those every month, right? Increasing health literacy, transparency, and awareness to externally, and then using those numbers internally to reflect on how their programs are doing. So this RFP that we've put out is to maybe be the stopgap for now, is to have a subcontractor come out and kind of do some of the work for this new office. But you are correct in saying that the CHA and other such assessments would be housed in this bureau and not just fall on one person. Kristen?
I was curious of what the current status is for reaccreditation this year for the DOH.
Yeah, so we put in our application in December, had to make some changes based on some feedback we got at the end of January, and now we're awaiting a site visit that should happen in the next couple of months. We're also in the implementation phase where we are working with the county. As you know, we did a regional reaccreditation process with the county, and so we have, is it 8 or 9 priority areas, Shante? It's five priority areas with some cross-cutting themes, which is where I probably inflated the numbers. And so those 5 cross-cutting areas have committees and committee chairs overseeing them, who are meeting. And so we're moving into the implementation phase of the priorities that we listed for the application.
Thank you.
Sure.
I have a question.
Absolutely, board chair.
Can you speak a little to the grants that are helping to fund your department's work and how stable those grant sources are?
Excellent question. Emmanuel, do you want to take a stab at that?
Yes, thank you. So our biggest grant is the Round White grant, and also the HAPWA grant, which is mostly for HIV/AIDS. So that's a continuous grant that comes in every year, and they are very stable because they've been on for a long time, and into the foreseeable future they will continue. And then we have a couple of grants from the state, public health emergency preparedness, and cities readiness initiative. We have the core function. Most of those grants are just continuous. So we can say that the grants that we have, we can confidently say that they are over 90% stable, and then we have some that just come in occasionally and then come and go and goes away. So that is the way I can respond to that.
Thank you. I guess a follow-up question is there a place for members of this board to support you finding grants, applying to grants, connecting to possible partners on grants that help align with the areas that you want to focus on?
Absolutely. And thank you for that. You'd think we had been in cahoots around questions, but we really didn't. And so I love this question. Anytime you see funding streams that you think would be of support, please send them to April and myself. We are always looking. The problem is we don't have a dedicated grants manager. So again, I think you're seeing a running theme of things I did not have. When I joined the department, I was like 52% grant funded. I'm the most grant funded health department in all of the states. And I don't have a grants manager. Didn't have one grants manager or anyone doing grants. So again, Emmanuel is really to be commended for his leadership, because prior to me coming and really working to help him, like, his bureau is still not the size it should be, but it's almost triple the size. And he was having to fill in those gaps, right? It was unreasonable. So we built in a grants manager position. We had someone who was there for a very short period of time before having to leave. And so we have that as a priority position that is open right now. So any one of you, especially the new board members, my biggest homework for you over the next month is to send us recommendations and referrals for the grants manager position. I will ask my Michelle Turner, who handles personnel and HR internally and liaises with the Department of Personnel, to send you a little blurb maybe that you could send out to your networks. But it's always salary. Salary is not going to be as competitive here, but we do support advanced starting salaries. But having a dedicated grants manager would change everything. It's really difficult. What accountants do day to day is very different from what people who either apply for and manage grants do, as many of you know. And so our accountants are not in a position to do that work. And Emmanuel has had to kind of steady that ship. The hiring of our, when I was hiring a commissioner, that was top of mind. I was looking for someone with a really strong fiscal grants management background to kind of fill that need. So the commissioner's leadership cannot be overstated here. I mean, she has been an incredible addition to the department, but again, she's a whole commissioner of health. She laughs at me when I say that, a whole commissioner of health for the city. She cannot be a stand-in grants manager. It's so bad that she has a full day that she goes and sits with the grants manager team and isn't in her office to fill this need. So if you all could assist in that area. I just want to shout out new board member Morgan, who literally, I said, I need board members to be active and to help us. Morgan had an entire meeting set with members of HR and personnel. And is it Brown, Morgan?
Yes.
All of my managers were invited to this meeting. Michelle Turner was there. And I mean, it turned around all of these different resources and ways that they're going to help us hire folks through their network. So I just really want to thank Morgan for her immediate call to action in supporting us. It was an incredible meeting and has amplified our ability and reach. But yeah, we need a dedicated grants manager. So if you have any leads, please do let us know.
And a couple of contract compliance officers that we also work with the grant manager.
I'm so proud. Emmanuel has grown so much. He has 2 offices under his bureau. And they're on 2 opposite sides of the department. So the grants folks We had to take back office space because, you know, we've grown the department by close to 40% and we needed office space. And so he has 2 sections under his bureau. It's really exciting now. I think that's all we have. Thank you, Board Chair.
Well, thank you so much. I don't know if there are any additional questions or comments from members of the board about the presentation or some of the goals that Dr. Mati just mentioned. All right.
And we'll send
well-
the slides as a PDF for you guys to take a look at. Happy to take questions via email after that as well.
Thank you. Well, we're still waiting for Dr. Tepe to join the meeting. So would you like to do the departmental updates? If you have any.
Absolutely. So you will be receiving this beautiful monthly report by tomorrow. Please note that in order to expand, can everyone see it?
Yes.
Okay. In order to, we have now moved to MailChimp so that we can expand how many people in the city. We were sending this to less than 100 people, and starting this month, it will go to a listserv of close to 500 people. If you know of people who don't get this report that you'd like on our listserv, please do email me and Shantae Flewellen. If you don't have her email address, Shantae, if you could drop it in the chat, and we will add it to the listserv. And so and you can tell that Erin Ford, who works under Shantae as one of our PIOs, does a beautiful job with this report, and she loves to highlight different parts of St. Louis in her art. So the Grove is beautifully featured. So as always, you'll see a little bit of an intro from me. Some of the big high impact things that happened is we made a big contribution to fighting the war against opioids in our region, which is a crisis, by installing the first Narcan boxes. There's one outside our building at 1520 Market Street, one outside City Hall, and now others are going out across the region. As well, really thankful to partners in the region that have been open-minded in facilitating this. These are incredible boxes that people can easily facilitate if they see someone who may be overdosing. They have instructions on the front and in the boxes themselves. And the Bureau has been doing training across the city for months on how to administer Narcan and how to use these boxes. So a big shout out to the Behavioral Health Bureau. We really, really are proud of one of our newest supervisors who was promoted internally, Tyrell Manning. Tyrell is just a credit to public health and to the department. He is a rising star and a phenom, and he was selected to address a full congressional hearing in Washington, D.C. on ending the HIV epidemic. Tyrell is a supervisor within our Communicable Diseases Bureau in the HIV prevention section. You will see him if you visit Pride this year. So I am inviting all of our board members to come to the Pride Festival that is next weekend right here downtown. Department of Health is proud to have the biggest turnout there. Last year we had 3 tables, games, giveaways. It was just a joyful time. We had dances. So you'll see the DOH team. This year we're bringing our vans as well, and we'll be doing STI testing right on site at Pride in our ARPA funded mobile vans. And you will hear more about our community outreach mobile van program that will be debuting in the next 1 to 2 months from Shantae Flewellen, our inaugural community outreach and communications manager. I have seen the draft of her strategic plan for community outreach. Please note, I asked her for a 1-pager, and she's turned around a full strategic plan document that is just exquisite. So you all will get that in the next month or 2. And so just congratulations to Tyrell for representing not only the city, but the state in DC in front of Congress. And then our family, community, and school health has partnered with Operation Food Search to offer on-site produce market and cooking demo for seniors. We've been having some very encouraging meetings with Black-owned farms in the city, especially in North St. Louis. We visited some small businesses that use, I'm going to say this wrong, but I think it's hydroponic food sources and growth. And the Urban League also debuted one of the biggest facilities to that end in the region. So just really excited about what's happening around food access in the city and in this space, and really proud of the Family, Community, and School Health Bureau for all the work they do. They do cooking demonstrations across the city and meet people where they are around this really important area. You will also get updates on our contagious illnesses. So big in the press is the new KP.3 variant around COVID. This is a new variant. It is now the dominant strain in the US and worldwide. Because it has the capability of avoiding our most recent vaccines and boosters. Well, the CDC is letting us know that there'll be a new vaccine later this summer, just in time for school. So we will be working on campaigns to really make sure people are getting that and we can get kids to school and stay in school safely. The H5N1 avian flu, I've done a couple of podcasts, one for the Infectious Diseases Society of America and one from the biggest journalist organization in the country. We can send you links to those, but you've seen this spreading. We've had 3 transmissions to humans. I've had meetings with the CDC around preparations they're doing. They're focusing right now on genetic sequencing to make sure that we understand what we're dealing with, that we have vaccine available. This is not high risk in the general public as of yet, but definitely high risk for anyone who works with animals and for farm workers. And so we want to make sure that they are supported during this time. So you'll get a little bit of an update on that. Then all of our bureaus will give you updates as we usually do. Remember, we give you a page of kind of the numbers and then a little bit of what's subjectively happening and where we've been. And they've been very active. I want to talk a little bit about our TB clinic that does a lot of work. This is one of the most foundational clinics where immigrants and migrants who reach the city have to go to. There's a lot of criteria for what folks need to immigrate into our country, and one of those is healthcare services. Top amongst those is TB. So we are often the first stop for a lot of families in figuring out the healthcare space and in getting them situated. Right now, our TB clinic is housed in one of Affinia's clinics on Biddle Street. And this is one of the only places that we have clinical services, the only formal place. Technically, the jail care we oversee, so that's not us specifically giving clinical care. And then we have our health stop in the Department of Health that provides HIV and STI testing as well. So really proud of the work that they do. Communicable diseases are ramping up. I'd like to congratulate Veronica Roy, who's been promoted to the Bureau Chief for Communicable Disease. We have a whole new section. We have Regina Sullivan as a new supervisor and Tyrell, who I just introduced you to. So just really exciting to see people grow within the department, us be able to develop leaders and see them progress within the Bureau. But you'll see increasingly that we're seeing a lot more communicable diseases. You haven't been used to that for the last couple of years because everything has been COVID intense. So you'll see that the St. Louis area has seen a rise in pertussis, 2 additional cases reported in May in the city, underscoring the needs to advocate for vaccines in children in infancy and prior to starting school. One of the disappointing negative impacts of vaccine hesitancy and the politicization of COVID-19 has been the drop in vaccinations for children across the country. And we're seeing that in the rise of childhood illnesses that really shouldn't exist. We have protections for them. So measles being one, pertussis we're beginning to see a bit of an uptick for. And then as the weather continues to warm, St. Louis has seen 150% more vector-borne illnesses in May compared to the 5-year median. This includes a case of babyosis spread by deer ticks and a travel-related case of leishmaniasis, a protozoan parasite that spreads through sandflies. So we're just seeing infections do what they do in this post-COVID era and really are trying to alert people to these foundational tenets of public health. I will let you guys go through the rest of the report at leisure. Please, as board members, take the time to actually read it. You get this sort of newsletter-esque version, but you also get like a report that you can read through with hyperlinks to go to different sections. The team works hard. Please make sure to go through it and email me with any questions, concerns, or ideas. We want to shout out Donald McGee, our Employee of the Month. I'm so proud of this young man. This is a young man that we brought on as an intern, and then we were able to develop him and then hire him into the department, which is exactly the kind of pipeline we like to see. He is by St. Louis, for St. Louis, born and bred in the region, and has just hit the ground running already, giving presentations to men's health groups across the city. And we want to congratulate our CDC fellow. We applied to the CDC for folks to come and help us with our personnel shortages through their workforce development program, the Public Health Associate Program it's called. So she's been with the department since October of 2022, has contributed to 4 different sections within the Department of Health during that time. That smile she has is just how Hannah rolls. She is positive. No job is too small or too large. So we want to congratulate her. She'll be moving on to one of the largest health departments in the nation in California in October. We'll be sad to see her go, but very grateful for the time she came to see us during to support us during the pandemic. So what's coming up? You can catch me every Tuesday at 9 a.m. on Streets 105.1. It's National PTSD Awareness Day next week. And then Pride Fest is the weekend of June 29 to 30 here, right here downtown. Please drop by, say hello to the team. For you new board members who don't know the team, what better way to get to know them? It's also National Minority Mental Health Awareness Month, so our bureau will be doing a lot of work around that in July. And I'm doing a lot of lecturing to young people in the region. Last night for Juneteenth was giving a commencement address to immigrants, high school graduates who voted me to come speak to them about their next steps after high school. It was a beautiful and just encouraging time. And so I'll stop there. Happy to take any questions about this little preview or questions in general before ceding my time to our board chair.
We do have one question from Robert in the chat, and I also want to mention we have quorum at the moment for the next 5 minutes. So I will allow you to answer Robert's question, and then I will ask for a motion to approve the prior minutes.
Why don't you go ahead with the motion and we can come back to discussion.
Okay, thanks. All right, folks, since we have our 7 members present, I will accept a motion to approve the April and May minutes from our prior meetings.
So moved.
Is there a second?
Melissa, I'll second.
Thank you. All in favor of approving the April 18th and May 6th Zoom videos as our meeting minutes, please say aye.
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 Are there any nays? Are there any abstentions? Motion passes. Okay, thank you.
So the question in the chat was, will the CDC fellow remain, or is that something the department must apply for each year? It's something we have to apply for. We applied during COVID. And so if we continue to need workforce capacity, we have to still see if the program is active and continue to apply. It's a really lengthy application process. And we were only granted 1 person. So while I applaud the efforts of the federal government, we would like to see, easier ways that we can increase workforce capacity. So I'll be bringing some of those ideas back to you. I had a recent meeting with the president of Goldfarb School of Nursing, and I would really like to see us come up with an MOU. And she was very supportive of thinking of innovative ways to increase the pipeline for nurses who are, that's the one job that we can have it on the website open for close to 2 years, because the salary gap is just so non-competitive for nurses in the health department compared to the private sector and in the hospital sectors. So we will continue to look to see if the effort for the application is worth 1, maybe 2 people being granted to us. But yeah, it was a one-time deal. Absolutely. You're welcome. Other questions, comments?
Well, it seems that we have neared the end of our meeting. I will ask if there are any additional announcements, either from the department or from members of the board, before we adjourn this meeting. I'll mention our next meeting is July 18th. And as always, you'll be getting the, or so I should say, board members will be receiving the agenda the week prior. And if you have any conflicts that you know of, please let us know prior to the meeting. All right. I am going to ask one final time if there are any additional comments or announcements that folks have. Hearing none, I'm going to adjourn this meeting, and I look forward to seeing all of you at the next one. Thank you. Enjoy your day and the rest of your week.
Hi, everyone.